Okay, the next type of block is called a bundle branch block. So previously we were talking about AV blocks. So we were focused on this space here, and for whatever reason the AV node was not receiving the communication like it should have been, so things were getting delayed. And then eventually they were getting passed down the ventricles. So the next part of this is when we have this split off here in the ventricles. We've got this septum that flows right down the middle of the heart, and we have these branches of electrical wiring called bundle branches, and they finish off transmitting the electrical signal out to the ventricles and driving the QRS complex and the depolarization. And so imagine what would happen if one of these had something blocking it, but the other one did not. What would happen is you would have a signal traveling faster for one side than it would the other. And so you would see a contraction of the right ventricle before the left, or vice versa. You would see the left contract first or before the right. And so the biggest way to distinguish a bundle branch block is that there are essentially two QRS patterns. Right? And so sometimes we call these rabbit ears, and I'll show you exactly kind of what they mean. So in a normal heart, we're looking at V1 and V6. So if you're looking for bundle branches, these are kind of your focal points. You look at the chest leads, V1, V6, and in a normal scenario, you see V1 is mostly negative, V6 mostly positive, and you can see how that would look normal. QRS interval, about a little over 2. Nice, strong T wave. Now when you start looking at a bundle branch block, you'll notice that in V1, you have this upward pattern, and then it looks like, okay, we're going down by normal, and then we'll have another upswing, and you have two rabbit ears, essentially. Now you won't see much over V6. You might see a little bit. Notice the difference there. Because remember, V1 sits right over the right side of the heart, the right ventricle. So in a right bundle branch block, you're going to see more on the right lead than you will on V6. And then vice versa. Now you'll notice one other thing. The QRS interval, look how wide it is. So whenever you see a wider QRS, you know right away that this is it's a ventricle problem. Okay, looking at the left bundle branch block, see V1 here, and then V6, you'll see this double rabbit ear thing here, and usually in an inverted T wave. Okay, so that's kind of the issue there with the right bundle branch block. Let me show you a couple of real world examples. They don't always look this clean. That's always the problem. Once again, just going back here, we call this an R and then an R prime. So if you look at this one, take a second and think, okay, what could this possibly be? It's a little bit hard to distinguish, but you can tell right away that the QRS is not normal. So you know right away this is not a supraventricular issue. Typically in your left bundle branch blocks, you're going to see some really messy stuff, V1, 2, 3, and 4. And if you were to look real close, we were able to zoom in, we would see a littlest deflection here. Okay, in V6. So usually in a left bundle branch block, you're going to have a pattern that looks a lot like this. you look at AVL, you can kind of see the deflection right there. Okay. Now, check this one out. You'll notice it doesn't have all the radical QRS stuff like the left bundle branch block does. But what you should see right away is this. And as we get further away from the right side of the heart, things sort of normalize just a little bit. I mean, if you were to look at this in isolation, you'd probably say it looks fairly normal. But that's why you really need the 12 lead ECG. And you can see this right bundle branch block right away. Inverted T wave, pretty common. Sometimes you'll see this in AVR as well, but you really see it in the chest leads, the first three. Okay, here's another one. This one's maybe a little bit more clear. Once again, we see all the radical QRS stuff in V1, 2, 3, and 4. And then as we get down to V6, now you can start to see the bunny ears a little bit clearer. AVL, it's very obvious. Even see a little bit in AVR in lead 1. So right away, you can tell something's up with this particular ECG.